the world's only sterile here.
Yeah.
Lovely. Take care. I'll see you guys shortly. How do you feel?
Good.
Any pain at all?
No.
Lovely. For doctors watching, this is a case of Lasik ectasia. She's had Lasik before, severe ectasia, and also had trauma, right? And had very high astigmatism from ectasia and trauma. So zonules are weak. We removed a very hard cataract. Like all our patients, there is no anesthesia other than numbing drops. Is that correct?
Yeah.
Wonderful. And I'm still inside her eye. We're now being very finicky, placing a very high toric astigmatism, Clarion lens technology on axis. Inside her eye for doctors, I'm being very finicky, placing a high toric lens exactly on axis to combat her LASIK ectasia complication, while also making sure we have everything done very well. Removed a very dense cataract. And here we are looking at the traumatic zonules, making sure they are stable with the haptic on the zonular area and coming out without a stitch. Congratulations. Here we go. So here we are. Just finished doing lens-based surgery for keratoconus patients all day. And actually all day we've been fixing patients with keratoconus here. And tomorrow we'll be doing more keratoconus patients who have landed. And we'll be doing LaZrPlastique, Corneoplastique in our laser suite. And this is where we did LaZrPlastique surgeries all day. We use various lens implants and our unique techniques to remove their cataracts or work on their lenses or piggyback or exchange and cancel out the keratoconic impact. In fact, some of the keratoconus patients are actually what we call surgical keratoconus, right? Meaning they have keratoconus surgically induced from LASIK and SMILE complications where the cornea starts bulging. And I showed you the cases. So it's very important to understand that keratoconus patients can see. They do see. We have to have that mentality and fight for them. So over 18 techniques we'll be employing between today and tomorrow. Patients from all over the planet. We just had patients from Canada, London, India, Ohio, Pennsylvania, New Hampshire, New York, California, and so on. And each one with different situations. They've had complications with their doctors, or they've had very extensive keratoconus, or they've been told nothing can be done. And you know, I don't like that. You must fight for them, keep safety always as a background. And you see me going on measuring, remeasuring them, and then performing all day today and tomorrow. All right, so we'll keep you guys posted. But any questions, just let us know. For you, Dr. Gulani. When do you get back to Texas?
Saturday.
Saturday. All right, great. So after he finishes surgery, Saturday he'll be flying. When do you guys get back to Canada?
Saturday night.
Saturday.
Yeah.
Okay, perfect. So all of you are going back together, right?
Yes, we are.
Okay, Dylan is same. Dylan and Cindy also.
Yes.
Perfect. All right, great. Hey, how are you? Now when do you guys get back to Vegas?
On the 29th.
29th. Okay. And what is all this amazing stuff?
The 50th anniversary from the Bahamas.
Really? You're from the Bahamas, right? And you're joining these guys from Vegas. So what's about this t-shirt?
Well, this is in celebration of our country's independence. 50 years we became independent. The 10th of July, 1970.
Look at that.
So 50th anniversary, we had a big splash of everything. Independence.
And all of you are wearing, what is it called? Bahari.
Bahari. That's the
Look at
main
this model.
brand.
Look at this.
That's the main brand. So everything has the logo. They always have Bahamas on their logo.
Michelle, you can come right here and
They
take
have-
it. Here we go.
This is celebrating 50 years. The goal is 50.
The Commonwealth of Bahamas.
Yes.
And then look at this guy, amazing. Commonwealth of Bahamas.
And then this one says not the comp, because we don't want the comp to go away.
That's it.
See, shortly we'll do the pre-op and then we'll go for surgery. Okay?
Yeah.
All right here. How are you?
I'm good.
When do you get back to Ohio?
Probably Sunday,
Sunday.
because we're
Okay,
leaving
great.
down here Saturday.
Perfect. Excellent. And here we are. So it is now that I've refracted you through your advanced keratoconus, and for doctors watching, patients have landed from all over the world here. This is a wonderful gentleman from Texas. We just saw the patient from Toronto, Canada. We saw the patient before that from London, before that from Vegas, before that from LA. And all these patients, incidentally, today are keratoconus patients of various severities, surgical failures, etc. Here's a gentleman who's had keratoconus, no surgery in this eye, right?
Yes, sir.
And again, what I'm constantly encouraging our colleagues to do, eye surgeons to do, is refract the patient. Look for their vision. Nobody has even tried because he's such a high advanced keratoconus. So we refracted him, and now we'll check. Alice, come on, can you read anything?
Yes.
Go.
FVNZTDHRL
Come on.
DOCVR.
Have you ever read with this eye like this?
No.
So doctor, it is so simple. Yes, you're seeing me personally refracting every patient as they're arriving and landing and checking everything, looking for vision potential, remember? So I can put them in the visual category of keratoconus or structural category. So has anyone tried to even see if you have vision in this advanced keratoconus eye?
No, doctor. Unfortunately, no.
Try, don't have to, try, read.
DAOFR.
Can you believe that, doctors? Coming with count finger vision, a young man, and nobody has checked, and he's even reading up to, come on, let's see.
ECT on HC.
Last one, come on, try, don't have to.
ECTHS.
Okay, 2050 minus now. Can you believe it from count fingers? It's worth it, right? So that's where I will take this patient in for surgery. Anything you want to say, Haris, from your experience quickly?
I'm really grateful and thankful all to you, doctor, for all your
My pleasure, my pleasure.
exams here and you taking care of me here.
Absolutely my pleasure. So we got you fixed here. I'm going to review everything, make a plan, and then proceed to surgery, all right?
Thank you, doctor.
How are you? Good to see you, good to see you. Please sit, please sit down. Anna, how was your travel from the West Coast?
I'm so glad I'm here.
That's a pleasure.